So, once again, good afternoon, everyone, and thank you all for joining. Welcome back to our second webinar on the HCBS IDD Modernization, specifically focused on the MFEI IDD project. And for those that are joining us for the first time in this webinar series, the MFEI refers to the Medicaid Functional Eligibility Instrument for individuals with intellectual and developmental disabilities. We are excited to continue to have this important engagement and conversation with our stakeholders. And we appreciate your dedication with the questions you're sending in, your interest in understanding the project, the impact of the project, and all the questions that, or just generally the questions that you have been sending in. Your involvement and input has been crucial in shaping how the project is implemented, and we will continue to take your feedback as we proceed and progress in the implementation of the MFEI IDD in the state of Kansas. So overall, some just quick housekeeping relating to meeting how we will be organizing this webinar. So if you have questions during the presentation, please feel free to raise your hand, put your questions in chat, and we will be monitoring chats and be taking questions and answering those questions as they come in. And in the event we run out of time and your questions are still unanswered, we will take those questions back, provide responses, publish them, and make sure you have access to the questions, to the responses to your questions. So with that said, I will go ahead and introduce our speakers for today. We do have on the call here the Assistant Commissioner for the Long-Term Services and Supports in KDADS, Seth Kilber is here, is going to be driving much of the presentation. We do have Robin Lohman, who's our Assistant IDD Director within the HCBS unit as well. We have Megan Shepard as well here, who's our Policy and Project Oversight Director within the HCBS unit at KDADS as well. And with that said, I will go ahead and share some acronyms that you will be seeing and hearing a lot about today during the course of the presentation. So KDADS, of course, refers to the Kansas Department for Aging and Disability Services. CMS, Centers for Medicare and Medicaid Services. The MFEI refers to the Medicaid Functional Eligibility Instrument, and IDD, Intellectual and Developmental Disabilities. Community Supports Waiver, CSW, Home and Community-Based Services, HCBS, Person-Centered Support Plan, PCSP. With that said, I would like to call on Assistant Commissioner Kilber to go ahead and start the presentation.
Sure. As Bruce said, my name is Seth Kilber. I'm the Assistant Commissioner for the Long-Term Services and Supports Commission here at KDADS, and I help oversee our 7 HCBS waiver programs. And so thank you all for taking your time out of your day. I also want to just call out the snafu with last week and the technical difficulties. For those of you who are logging on hoping to get this presentation a week or so ago, and we weren't able to do that, I just again wanted to say we sincerely apologize for wasting some of your all's valuable time. So without further ado, I will kind of jump into the background here on our plans around this Medicaid Functional Eligibility Instrument transition. So high level here, we are planning to continue to modernize and improve the HCBS IDD waiver program. Currently, the IDD waivers reliance on the basis assessment tool creates a lot of inconsistencies and complications that would especially be amplified if we were to not use that same tool on the community support waiver. So it's really important that we've got two separate um, intellectual and developmental disability waivers. One is a very comprehensive waiver providing a lot of support. One that we're currently in development is going to be a little bit of a lighter touch waiver aimed at hopefully to reduce some of the waiting list and allow us to serve quite a bit more people. But we do require both of those waivers to use the same level of care eligibility tool. And so that is a big driver. I would also add that the special committee that
Oh my God.
met at, I think we've got some people unmuted right now. So I would add that the special committee that met in 2022 related to the IDD modernization. This was a resounding recommendation of that committee to move away from the basis assessment because of the sort of dehumanizing element and impact that it had on individuals. So I think we are ready for the next.
Seth, I think you're on mute.
Oh, can you hear me now?
Yes.
Okay, thank you. I seem to be continually muted by somebody. So just to recap the MFEI impact on current participants, your reassessment after July 1, 2025 will be done through the MFEI IDD. The provider reimbursement tier will not change until at least July of 2026 for current participants. Tiers do not determine services and support. Rather, the service and support needs determine tiers. So tiers are really only for those provider reimbursements. The services and supports are going to be provided for regardless of the tier assigned to you. And if your needs change or become more complex, your provider can get an enhanced reimbursement rate. So that is a process and a mechanism that exists today. That mechanism will still exist after we roll out the MFEI. So current participants will not lose services, and services will not be reduced in scope, length, or quality. And between now and the end of the American Rescue Plan, or ARP, maintenance of effort period, anyone who the American Rescue Plan maintenance of effort period ends at the end of December of 2025, so this year. But anyone in this period found ineligible under the new assessment tool, we will verify that by conducting a second assessment using the BASIS tool. So this will verify and validate the outcome of the MFEI IDD. However, through extensive testing and prior years, we have a very high degree of confidence that there's going to be very few people impacted and found ineligible under this new tool. So KDADS is also going to have effective and efficient oversight of the new provider reimbursement tier system. So it's not going to be a free-for-all with managed care organizations deciding what bucket of tier to put somebody in. It will be something that is utilized based on statistically valid assessment tools. So that is one of the benefits of moving to a validated tool like this Medicaid functional eligibility instrument. So thus far, the project status, we are on track and set to go live for July 1.
Oh, I got it now.
We've heard we've heard through stakeholders that initially we had a March 1 date, so we've kind of heard from folks that felt a little too soon. So we did go ahead and set that go live date on July 1. We've got some of the waiver amendment processes in flight, and approval is anticipated for June, coming from the Centers for Medicare and Medicaid Services, who do have to approve our waivers before they are implemented. And the managed care organizations have begun the process of transitioning to the NRI care planning suite as required by KDADS. So they will be standardizing their care planning tools across the board between all three, whereas currently they each are using a different tool. The full MCO transition is expected to be completed by July 1 as well. As far as communication, right now, KDADS has completed 2 of 3 webinars to inform providers of these upcoming changes. Our next one is planned for February, and just keep an eye out for additional dates for future webinars, because we intend to make these recurring. We've also launched a HCBS IDD Modernization newsletter. This provides, important updates about the ongoing transformation of the IDD waiver program, and so we'll continue to provide those updates via that channel as well. Then we've been utilizing other avenues such as social media, newsletters, videos that we want to post, emails and phone calls. And then the last one that we're very excited about is we're going to be launching a kind of an open office hour every other week. I think we're going to start that next week. But we want to have that open for folks to kind of come in and just kind of ask questions in a very informal way, and hopefully we can dispel some myths and assumptions that have been really floating out there about this project. Robin, are we ready for you, or is this still me?
This is me.
Okay, thanks, Robin.
Yeah, thank you, Seth. Yeah, I'm Robin Lohman. I'm the Assistant IDD Director, like Brutus mentioned first thing. And I'm here today to talk about the MFEI documentation requirements, which I'm happy to say that we're going a different direction, and we're not going to require any MFEI documentation requirements to be uploaded by the CDDOs. So with that direction, I know that's changed from the last time we've met. So the MFEI will not require extra documentation beyond the IDD system eligibility verification completed by the CDDOs. So when you're coming into the CDDO for your initial eligibility, there is still eligibility documentation that will be required. This decision does align with the NRRAI standards and reduces administrative burden on families and providers and CDDOs too. The CDDOs will remain responsible for system eligibility. I also wanted to add real fast that your local CDDO may have different requirements based on their internal policies or stuff like that. So we also kind of want to maintain consistency on what you're used to. And we are going to continue to meet. KDADS will meet with the CDDOs to kind of ensure that there's some standardizations across the state as well. But as far as KDADS requiring the CDDOs to upload MFEI documentation, we're not going to be requiring that. So ongoing monitoring for accuracy and reliability. KDADS will conduct a regular MFEI review process to ensure the tool remains valid and reliable. KDADS will continue to focus on training and technical assistance before making major system changes. And then our commitment to person-centered support. We want to ensure a seamless, efficient process for families and providers. We've been listening to feedback from many different stakeholders and making adjustments to better serve Kansas. We want to focus the right level of care for every individual without any unnecessary complexity. So I'm going to turn it right back over to Seth. Thanks, Seth.
Yeah, I did see, Cami, your question about the open office hour real fast. I wanna address that. While you are welcome to come physically to my office, I will absolutely welcome you in. That this is something. It's just a term for it will be virtual. So don't worry about needing to make the drive from wherever you reside in the state to come participate in those. We'll have the link out for you when those are ready to go. So touching base on the standardized needs assessment. So the purpose of this is to really help determine those provider reimbursement rates for day and residential services. As a reminder, those are the only two services that have acuity-based rates. Every other rate on the IDD waiver is a single floor rate. So what this process will look like is KDADS is currently collaborating with the MCOs to develop the set of questions that will be used in addition to the NRI care planning tool to assign tiers based on those person-centered support needs. This is what's going to help determine the provider's reimbursement rates for day services and residential services. The questions are going to be integrated into the actual person-centered service planning process that the MCOs are already required and currently facilitate. So that is typically an annual meeting between the care planning team, the participant, where they're kind of making sure that the target case manager is often involved as well in those meetings. So that nothing's going to change about that process. But the scoring methodology will be reviewed and vetted by KDADS prior to implementation. Some of the key advantages of this new process are it's going to be conducted as part of the service planning. So it can kind of just be integrated already into what is an existing process. It's going to focus on person-centered needs. So we feel it'll really get at what the person is really wanting to get out of from the waiver program and hopefully meet their needs and their goals in a much more comprehensive manner. And it's going to be standardized across all three MCOs. So KDADS will continue to perform the ongoing monitoring and oversight for this process to ensure that it's all conducted and done above board. So just a high-level overview of the next steps of this MFEI IDD 2025 rollout. Currently, you can see we're in the February month, or just about. I don't want to get ahead of myself here. So we are in that initial. We're going to be entering that initial review of the needs assessment for the provider reimbursement tiers, and then we'll continuing to do our communication, webinar, newsletters, town halls through February, March, and April, and throughout the life of before we get to July. And then in May, we will do final stakeholders review of the needs assessment for those provider reimbursement tiers. And then in June, things start to really ramp up where we do some of the back end development work on our end to get the MFEI into the final production stage. And hopefully we'll have our CMS approval of the proposed amendment to the IDD waiver effective for July 1 of 2025. And then obviously once we are in July, all assessors and IDD level of care assessments will be conducted using the Medicaid functional eligibility instrument at that time. So we ran through that really fast and want to kind of open it up now to questions. So Bruce, I don't know, are we triaging it through you?
Yes, I am going to be looking at the chats now and providing some questions here. And if anyone does have any question, if you want to come off mute, please raise your hand and we will call on you to ask your questions. So a question from Cami. In December webinar, it was said that the MCOs will determine the tier. Isn't that a conflict of interest? Said.
A conflict of interest in what way? I guess I would ask. CMS has waited. I mean, the MCOs are not providing services. And so that's where the conflict of interest when as far as from a waiver perspective, the conflict of interest becomes when there's the entity require that the entity involved in the person-centered service plan and the person-centered support plan is also a waiver provider. So that is where the conflict of interest discussion is typically coming into play.
Thank you very much, Seth. Message from Vincent. Will this replace the basis? Are we going to be affected with the administration's plan on passing? Mhm.
Yes, to answer the first part of that question, yes, this will replace the basis. I'm not sure I fully am understanding the second part of that question, Vincent. If you want to raise your hand and come off mute to expand on that, I think we can hopefully answer that, or if you can provide clarification in the chat, we can come back to it.
Awesome. Another question from, oh, go ahead, Vincent, please.
Okay. No, I was just want to know with the new administration that they're talking about getting rid of Medicaid and Medicare, Social Security and all that, is that going to affect us, or do we know what's going to happen?
No, we understand there's a lot of things happening right now at the federal level with the change of administrations, and we're monitoring this closely, like many of you are. But I can't really speak to some of those broader discussions happening at the Fed level around what's going to happen to Medicaid in the coming months and years.
So, I mean, I know we provide a service. So what happens if they do? I mean, is there a backup plan? I mean, is there any idea? I mean, I know you said you don't know what's going on, but let's say it does happen. I mean, is there a backup plan just in case?
That would require a much deeper and broader conversation, Vincent. We're hopeful that Medicaid will be, and HCBS will be protected, and a lot of advocacy being done there. But I think that's one that we would have to, we're just monitoring it closely and would, absolutely, have a contingency and plan in place if that was the case.
Okay, thanks.
Thank you very much for that question, Vincent. Another question from Kemi. What is the difference between the MFEI IDD implementation and the NRI service planning suite?
So, yeah, this is a common point of confusion. So the MFEI IDD is built off of the NRI care planning tool. So it is essentially a screener, where you've got the full suite of tools, and we pulled out certain questions that we wanted to utilize to factor into when a person is determined eligible for the IDD waiver. However, part of our licensing agreement with NRI requires that we do the entire care planning piece. So that is where the MCOs are going to then pick up the excess and finish the NRI. So we are not wanting to duplicate what questions will be asked of you in that MFEI meeting. However, those questions are utilized to then round out the rest of those care planning assessment tools that the MCOs will do, and then that gets fed into part of what they are doing as far as the tier placement.
Thank you, Seth. And we have a hand raised from DW. Do you want to come off mute and ask your question, please?
Are you able to hear me?
Yes.
I want to go back to the conflict of interest because you can see it in multiple comments here. The conflict of interest is that the MCOs are profit-driven companies. How is it not a conflict of interest for them to be directly involved in setting the rates? And then what recourse do providers have if they disagree with the rates? So there is a conflict of interest that's very evident. So why are they even involved in setting the rates?
So the state sets the floor rates, and the MCOs aren't actually, we're telling the MCOs what the parameters are around the rates. They just have to have the mechanism in place to figure out which bucket people are fitting in. So that is essentially what we're doing. We're assigning them the task of ensuring that they're using these validated tools to put people in the right bucket, if you will. So the MCOs aren't being charged with doing this in a willy-nilly way, if you will. That the state is the MCOs are tasked with performing administrative Medicaid functions on behalf of the state, and this is part of what we're leveraging with them.
Thank you very much, Seth. DV, do you have a follow-up question to that? I ask because I still see a hand raised, but thank you very much for that question. I missed one from Richard about who was in the 2022 work group. Was it a broad group of stakeholders, parents, guardians, and providers? Seth, do you have any quick response to that? I know we can always go back and look at who was in that work group, but
Yeah, I think we had about 15 people in the work group. Obviously, when it comes to work groups, you can't have everybody who wants to be on it. But we can look and get some information about what the composition of that work group looked like.
Thank you, Seth. DV, do you still have DW, do you still have a question? Just wanted to make sure I checked that off before.
No, I don't feel like that sufficiently answers a conflict of interest. I mean, you can see all the comments. Even if the state answers the floor, sets the floor levels, the MCOs should absolutely have zero involvement in setting rates. But I think you can see that through the comments. That's a common thread. So I'll just mute my mic at the next point.
Yeah, I want to reiterate and clarify that the MCOs are not the ones setting the rate. The state sets the rate.
But even beyond the floor rate,
Right. Yes.
the state will set them beyond the floor rate.
Yeah, the MCOs are still going to follow the tiering methodology that is established by the state using that validated data and the MFEI tool.
Thank you very much, Seth, for that clarification. And I believe our volume 1 of our newsletter does go into detail what those rates are. So for our stakeholders on the call, if you have questions exactly what the new rate system looks like, please refer to our volume 1 of the newsletter that we published. I think the agency did a great job with explaining what those new rates are, and the idea that individualized rates will continue to still be utilized for individuals or participants with very complex cases. DT, I see, let's see here. Debbie, yes, please ask your question.
Yes. Can you hear me?
Yes.
I was wondering if we could get more clarification on what it means when it says the MFEI will not require extra documentation beyond the IDD system verification completed by the CDDO, like specifically on the MFEI section 4 maladaptive. When it talks about wandering, elopement, verbal abuse, there's an intra-RAI code, and it talks about is it being done Did it do that daily for 3 days? So is that documentation that's not going to have to be done and it's verbal? Or I guess I'm really confused about what is the documentation that's going to be required.
Sid, do you want to take that, or should I call on Robin to shed some light on that?
Yeah, I can kind of take a stab at it, and Robin, if you'll
Thank
fill
you.
me in or augment anything I say here. So right now, CDDOs determine eligibility for the IDD waiver program, which means they're looking at ensuring that a person has kind of a qualifying diagnosis, the required number of substantial functional limitations that have to be attached to that, and kind of making sure a handful of other boxes are ticked prior to make all to ensure that yes, you do have an intellectual and or developmental disability, and then once you've kind of made it, jumped through that hoop, so to speak, then the CDDOs will proceed to go on and schedule an assessment for you. So that's kind of the piece that the CDDOs do. So that part is not going to change. However, as far as the documentation requirements goes, in short, to answer your question in short, yes, it is going to be primarily verbal, and so that's why it's really important to have those who really know the individual best, and know kind of their care needs and support needs at the assessment to be able to answer those questions to the best of their ability. But I will allow Robin to chime in with anything additional if she has.
Nope, you got it.
So
Thank
when
you,
you
Sid.
talk about verification, it's annual verification, and then the MCO is going to follow up with the intra-RAI, or is it initial verification?
Once you've been determined eligible for the IDD waiver program, that usually sticks with you unless there's some other kind of edge case for a redetermination of eligibility. So if you're talking about the initial eligibility, no, that's not something that is done on an annual basis. If you're talking about the inter-I, what the MCOs do, that's a component of the person-centered service planning meeting that is a requirement to be done on an annual basis.
Okay, so on an annual basis, it will just example section 4, it will just be by mouth, like somebody saying yes, they wandered every day for the last 3 days versus
Yes.
documentation.
Yeah,
Okay.
You've got that correct.
That answers my question.
Thank you. Susan? I see Susan Davis, you have your hand up. Do you want to ask your question?
Sorry, I helps to take off the mic thing.
Oh, okay.
All right.
No worries.
My question was just a little bit of a follow-up, and it might be two different areas of oversight. But so on the documentation requirement, while the frequency is not required on the annual for the MFEI, would someone expect to see it in the person-centered support plan, especially if there are things that are done with daily frequency? Or is that more of a licensing thing, not a MFEI?
Yeah. I mean, that's a good question, and Robin, I might call on you for this one too. Really the person-centered service plan and the support plan that's really what needs to drive the services, and so that's kind of the intent. The goal here with this MFEI is really a binary yes or no. Are you eligible for the waiver program, or are you not eligible for the waiver program? So it could be that it's a licensing thing. I'd have to go back and look at some of those TCM regulations because there are kind of requirements as part of a target case management licensure that you have to have certain documentation on file. So I don't know if that sort of gets at your question or if Robin, you wanted to add anything.
I think you covered it. I think, yeah, if there's a positive behavior support plan, then it definitely needs to follow Article 63 and all that stuff on frequency and severity behaviors. And that's for TCMs and individuals to be able to look to see if that plan is working and adapting as necessary. So that's the only other thing I had to add.
Thank you, Seth. Thank you, Robin. And if you don't mind, if your questions have been answered, Debbie, DW, please, if you don't mind taking your hands down, so that others might be able to ask
I have a
their
new
questions.
question.
Okay, please go ahead, Debbie.
Okay, I wanted to clarify on the MFEI. I've been told from the CDDO that the CDDO will do the MFEI, but everything on the MFEI that has the asterisk that says not an intra-RAI item, those items will not be included on figuring the tier rate by the MCOs for the individual. Is that correct?
I don't know that we're at a point where we can definitively answer that question just yet for you.
Okay, because I just want to voice my concerns because one of the major ones is health and medical diagnosis that comes into play with how much support an individual needs.
Mm-hmm.
And so how are you going to actually grasp the support needs of an individual if you don't even take in their medical diagnosis? So my own opinion there.
Yeah. There will definitely be quite a bit more that goes into what ultimately determines that tier for that individual than just what is on the MFEI. So there's a kind of a whole suite of assessment tools and kind of the NRI is very comprehensive. And several other states actually use this to determine kind of acuity-based rates as well. So we're monitoring how they're doing that as well. And so, yeah, we'll have more information as we kind of further develop this too.
Do you have a projected date when you think you'll fully decide what's going to be figured into that tier rate?
We'll have it figured out by July 1, at the very least. But again, like I said, with the communications, we're gonna continue to have updates roll out through our newsletters and our IDD Modernization webpage, and additional webinars.
Awesome, thank you. And to quickly cover some other questions, if you were wondering how to get our newsletters, emails, and alerts, we have added links to the chat. So please go in there, click it, so that you can get updates whenever we release a newsletter or we send out emails and alerts to our stakeholders. So please go in there. The link has been provided by KDADS for you to click and access and register to receive news updates. Other questions from Bonnie. Will families be able to obtain a copy of these assessments for their own verification?
Sorry, Bruce, can you repeat the question?
Yes. Will families be able to obtain a copy of these assessments for their own verification?
Yeah, I would think so. We haven't quite got to that point yet, but I don't know why families wouldn't, participants and guardians would not have access to the assessments completed by the CDDO or the MCO.
Mm-hmm. Awesome. Thank you. And some of the questions here we have covered. When will training be provided for providers and TCMs?
Training on the actual MFEI being conducted.
That is what I'm assuming that is referring to.
Robin, do we have an answer to this one?
We don't have a strong answer, but Latanya is working on some trainings, and they're kind of be for like guardians, family members, other of those kinds of scenarios. A general kind of training on the MFEI and what their role is in that. And I know that she is presently working on it. I don't know when our next meeting's set up, but we're moving forward with that.
Yes. And just to add to that, that would be kind of a general basic training, introducing families, providers and TCMs to what the MFEI is, what it is not. So kind of general. The more specific tool training applies to the CDDOs and assessors, CDDO assessors, that drills down into each of the components, in the MFEI. Other questions? Do providers and individuals served get to provide input on the needs assessment and the proposed tiers? And this is one from SKO.
Sorry, I was trying to follow the question.
Yes. So on the proposed tiers and the needs assessment, do providers and individuals served get to provide input?
Yeah, we're looking for input as we go. So we're nothing's finalized, nothing's absolutely set in stone right now. So yeah, I mean, please, as you continually see the updates, give us that feedback and those updates, or sorry, the feedback and responses to kind of what this process is looking like. So our aim is to be as transparent as possible with where we are in the process and what that actual needs assessment, spinning up the tier will look like.
Awesome. Thank you very much, Seth. And I think, Seth, we might be losing your video. So in case if you're not hearing us, there might be some connection issues here. But I have a hand raised, so let's move to Lichelle. My apologies if I did not pronounce that properly, but please ask your question.
Yes, you pronounced it correctly.
Thank you.
I was just thinking about the wait list, all of these changes that are going to be implemented. How is that going to affect the people that are still on the wait list, who have been on the wait list for years? Is this going to get them off of the wait list any faster? Is it going to change? Is it going to affect them in regards to, what their initial eligibility verification was? How will all of this affect the people on the wait list?
So you get on the wait list by having been determined eligible by the MFEI and then having a level of care eligibility performed. So if you kind of make it through both of those eligibility hoops, you can be placed on the wait list. We've done extensive testing with this, crosswalked with the basis, and there's something like a 99% of people eligible under the basis assessment are also eligible under the MFEI. It's a very, very high kind of margin of error there. So again, like we stated earlier in the presentation, the goal here is to get a new community support waiver up off the ground and stood up, so that people that we can start pulling and serving more people and get them off the wait list. So we really don't anticipate that this would impact those on the wait list now, until we've actually got a wait list, or sorry, not a wait list, a new waiver implemented, and we can start serving people. But as far as negative impacts, I really don't think there are going to be any.
Okay, thank you.
Thank you very much, Lichelle, for that question. And we have some other questions here. One, can the MFEI still be conducted virtually or in hybrid meetings? Then another one is, are there other states using the MFEI? And if it was developed specifically for Kansas, why could we not use tools already in use elsewhere? Seth?
So this was a decision made, I don't even know, back in 2014, 2015 to utilize this NRI for level of care determinations on our HCBS waivers. So to date, we've already implemented this back in 2019 for our brain injury waiver. And that was one of the strengths of why we decided to go this route, is it would allow us to do a level of care evaluation for all of our adult waivers using essentially the same tool. So the benefits there, and being able to actually help folks kind of navigate in between waivers, as there are individuals who kind of are eligible for multiple waivers and transition between two or more waivers in their lifetime. So that is one of the benefits of going this route. But then there was just honestly the element of having developed the tool specific to Kansas, and having the kind of the recommendation from the IDD Modernization Committee to definitely move away with the basis. And it at this point, if we were to look at another tool, we would significantly delay the rollout of the new community support waiver that we are developing.
Mm-hmm. Thank you very much, Seth. And the second part to that question, and I can help with that, is, if the tool was specifically developed for Kansas, and why could we not use tools already used elsewhere? So just based on the information that the project has been looking at, there are other states that are doing very similar to what we're doing. Iowa is one of them. They actually are using a tool that was considered back in 2014, 2015, when the decision to go with the NRI was taken. One of the tools examined was the CIS, and that today we're seeing Iowa transition from the CIS to the NRI, mainly because of the benefits that the NRI does provide, the person-centeredness that drives the NRI tool. So that was just on that question. But then we have a hand raised, and I think I lost it. Please feel free to raise your hand if you still have that question. More questions on conflict of interest. A question from Andrea. Oh, and Ben, just quickly, I'll take the one from Andrea. Can you explain more about the documentation? Seth, Robin, do you have anything on this one?
What was the question? I'm sorry. There's so many questions in the chat.
Yes, can you explain more about the documentation?
Well, from my perspective, the documentation that the CDDOs require at their local level is going to stay the same. Initially, at the state level, we were going to require CDDOs to upload that documentation for us for different kinds of reasons. And so that last piece is eliminated. We will not be requiring CDDOs to upload any kind of medical documentation or behavior documentation or anything. So does that answer the question?
Yes, thank you very much, Robin. And if there's a follow-up question to that, please feel free to come off mute and raise your hand and ask, please. And I see Ben. Ben, do you want to ask your question, please?
Yeah, mine's just kind of a technical question. I don't know, will there be a separate meeting for technical related questions? I'm with IT and I work with the CDDO. We spoke earlier, and it appears as though we won't be able to download the assessment data like we do with the basis currently. That allows us to print it out and distribute it to providers. But since we won't be able to download the assessment data, will there be a save as PDF button on this new interface that will let us at least save the document itself? And also the new assessment download that we'll be able to have actually doesn't say whether or not the person passed the assessment, the simple yes or no for functional eligibility. Could that be added? Otherwise, it's not a very useful download.
So, and Seth, do you mind if I take this one on?
Yeah,
the
please.
tool? Okay, yes. So Ben, thank you very much for that question. So there are two opportunities to print out the assessment in the application. First is in the front end, like the application front end. Once the assessment is completed, there's a print button there, kind of the print icon. You click it, you'll be able to download the assessment in PDF format. If you miss that point, if you get into KMIS, on the table there that shows you the person and the assessment, you can still, I believe there is an opportunity to also print from within KMIS. That I could still verify, but for sure I can tell you that on the application at the front end, you can download a copy of the assessment. Now, when it comes to data, some data here are proprietary to NRI, especially around the scoring algorithm. So you may not see like the scoring algorithm, but the data that is still essential. Some of the reports that you get on the basis, minus any type of algorithm data, scoring data, you would still have access to that with the MFEI. And I believe we shared some example reports from our test environments with you. If there are others that want to see what those reports look like, please reach out to Robin, and then we can facilitate those to you.
But will it include like a yes or no as to whether or not they passed the MFEI?
Oh, yes,
Because
yes.
It doesn't include that in the spreadsheet I was given.
So I sent another spreadsheet, and I'll reach out to you offline. There's another spreadsheet that has a column that tells you whether they are eligible or not eligible. You get to see that determination in that spreadsheet.
Perfect. Thank you.
Thank you. Thank you, Ben, for that question. And Sherry, thank you very much for being here. Please ask your question.
Yeah, Brutus, this question is for you because I think maybe there's some new clarification in past discussions that I've had, I think with you and Seth. My question is if everything that we put in the system, we'll be able to download it just like we are in our current system. But it sounds like that's changed some. Is that correct? Did I hear that incorrectly? Meaning if there's a data element on the assessment and we enter an answer to that, are we going to get all of those data elements back? Or I think what I heard was some of those data elements you won't be able to release. Is that?
So let me go back and make sure I have a proper response. Let me take that back. But you will be able to get, I know for sure you get some data element like the functional eligibility determination. But again, anything that has to do with the scoring algorithm, that's NRI's proprietary to NRI. And so we may not be able to release that, but definitely you will get some data element, that as you currently get on the basis. But let me take that back to see what we currently have from our tests, our UAT.
Okay. Yeah, if we
thank you, Sherry.
Could distribute a sample of the report, that would be great.
Absolutely. Absolutely. Thank you very much, Sherry.
Thanks.
And we have Craig Knudsen. Thank you, Craig, for this question. So quick question, will there still be 5 tiers? Are we, keeping the tier system? Seth, please speak to this.
Yeah, so we've kind of gone a little bit around on this. The short answer now where we are, where we've landed is yes, there will be tiers. There'll be three standard tiers and one enhanced funding tier that will serve as sort of the extraordinary funding tier for those that go beyond. So the parameters for those tiers are the same. Again, I can't stress this enough. This is not a cost saving measure for the state. We're not taking any money out of the system by any means. So the lowest paying tier will still remain the same as it is on the lowest paying tier for the current system. The highest paying tier, as it is for the under the current basis tier system, is still going to be the highest paying tier.
Awesome. And we have 3 minutes. Sherry, do you want to, you have another question?
I'm sorry, Brutus, I forgot to put my hand down.
Oh, okay. I figured that was the case. Craig, thank you for coming off mute. Please ask away. Craig? Oh, yeah. Craig, I see your hand up. You have a question for us? You might be talking on mute.
Okay, maybe this works now.
Yes,
Okay,
it does.
so originally, the basis when it was originated with the 5 tiers kind of assumed that there would be an equal distribution of people across the tiers. And so like they represented quintiles. But over time, what we found as a state is that they all kind of drifted or trended towards tier 1, tier 2. And so that distribution was no longer the same. Are we anticipating a similar distribution with the 3 tiers, like each tier having a third of the population?
Yeah, that would be the intention, is that you kind of a third, and then a rebasing is kind of done over time, so it's adapting, and so the population kind of then is always falling into the distribution then looks similar over time, and so you don't get into those kind of drifting or those tier creep situations.
And thank you very much, Craig, for that question. And thanks, Seth, for that response. Understanding we have 1 minute left. Thank you all for this participation. Just wanted to acknowledge the comments in here. That does show appreciation to our ASL personnel on the call. Thank you very much. And thank you all for participating in this. Just quick housekeeping. You have access to all the information and communication coming out from KDADS. Reach out to KDADS, get added to the listserv, get those emails, get the newsletter. The open office hours, call in. It's going to be less formal. We might not have a presentation, but you have the opportunity to talk to HCBS leadership in the state, ask questions related to the HCBS Modernization project or program, as well as related to questions that you have that you want to ask. So come on there, ask questions, send in your questions. The leadership have been very great with picking up phones and calling participants to respond to questions and emails. So continue to use that to provide your feedback. But with that said, do you have any final word for our stakeholders on the call today?
No, just we really appreciate y'all being here and asking the hard questions and putting it to us. So we're going to continue to get this communication out and make sure you all have the information that you really want and need.
With that, thank you all for being here. Have a wonderful rest of your day. Thank you and bye-bye.
Thank you, everyone. Good night.